U.S. President Donald Trump has spoken out for the first time from the hospital where he's being treated for COVID-19. He released a video message on Twitter adding that the coming days will be the real test of his fight against the coronavirus. Earlier, the president's doctor also said he was doing well, but follow-up questions shifted to focus on the timing of Trump's infection and diagnosis.
Doing his best to reassure the United States.
I came here, wasn't feeling so well. I feel much better now. We're working hard to get me all the way back. I have to be back because we still have to make America great again. We've done an awfully good job of that, but we still have steps to go and we have to finish that job. And I'll be back. I think I'll be back soon. And I look forward to finishing up the campaign the way it was started. But we have things happening that look like they're miracles.
But admitted the coming days would be crucial.
So I just want to tell you that I'm starting to feel good. You don't know over the next period of a few days. I guess that's the real test. So we'll be seeing what happens over those next couple of days.
Early on Saturday, the president's medical team had also given an update, explaining their decision to transfer him to a military hospital.
As reported yesterday, consultation with this group, I recommended we bring the president up to Walter Reed as a precautionary measure to provide state-of-the-art monitoring and any care that he may need. Just 72 hours into the diagnosis now, the first week of COVID, and in particular days 7 to 10, are the most critical in determining the likely course of this illness.
But that clarification caused confusion. 72 hours into the diagnosis would mean he was confirmed infected on Wednesday. Trump only announced that he and the First Lady had contracted COVID-19 early on Friday. The president's doctor, Sean Conley, later issued a statement correcting himself. Following an event at the White House Rose Garden last week, a number of prominent Republicans have also tested positive, including 2 senators from the Judiciary Committee, who are due to consider Trump's new nomination for the Supreme Court. Though Trump is reportedly on the mend, his chief of staff says the next 2 days will be critical in the president's fight against COVID-19.
Joining us now is our correspondent Carolina Chamoy in Washington. Greetings, Carolina. We just heard the president say he's doing well. Did he also defend his decision to continue campaigning without a mask?
Well, in this video, the second one he released from the hospital, he's definitely trying to kill the rumors we heard yesterday saying that his health condition was quite serious. We don't know, though, if this is going to change anything on his position towards the measures to stop the infections in the States, like wearing a mask or keeping a social distance. We have to consider that the mask has almost become a political symbol in this country. Trump has criticized the mask and even made fun of Joe Biden, for example, during the presidential debate because he always wears a mask. Is he now going to change that position openly, perhaps after having been hospitalized for several days due to his COVID-19 infection? But we don't know.
As you know, more people in the president's inner circle have tested positive in recent days. How certain are we that that Rose Garden event was, in fact, the super spreader moment within the president's team?
This has not been confirmed that ceremony last week in the White House was the place where several people got infected. But we do know that at least 6 people, including 2 Republican senators who attended that event, have been tested positive for COVID-19. So it is highly likely that this might have been the event where they contracted the infection. Also, we have seen in the images that we got that they are not wearing a mask and they are not keeping social distancing. So this could be the spreader event, yes.
How are these infections affecting the Trump campaign team a month now from the presidential election?
The impact on the campaign is huge, especially for Republicans. Trump had to cancel his campaign events for this week. In the new video he published, he says he thinks he is coming back very soon and that he wants to continue with his campaign to make America great again. But as for now, he has stopped the campaign and all the events. Biden's campaign, by the way, said the candidate Joe Biden will get tested more frequently and will now continue the in-person campaign. His results of the tests are going to be disclosed every day.
Carolina Chamoy in Washington for us. Thank you so much, Carolina. Since Donald Trump announced his diagnosis on Twitter late on Thursday, misinformation has been spreading on social media about the president. Some are even questioning if Trump is actually ill. Who can we trust when it comes to the president's health? DW reporter Ola Alsika joins me now to talk more about this. Where do we begin, Ola? I mean, tell us about the theories that are spreading online.
Yeah, first of all, there is, of course, no evidence that Trump was lying about his diagnosis. He's now being treated in hospital for COVID-19. And as with any conspiracy theory, it would have taken a lot of people to be in on it if the theories were true. But it is fair to question a statement that comes from Donald Trump. Washington Post, at their latest tally, said he had made 20,000 false or misleading claims in his
20,000?
20,000. It might get to 25 by the end of October. And so when this news broke on Wednesday, social media really exploded with theories on both extremes of the political spectrum, to be honest. On the left, you had the documentary filmmaker Michael Moore, for example. He suggested that Trump was faking this to somehow postpone the election. Others were saying that he was faking it to get out of doing more television debates after that chaotic debate earlier in the week. Others again said it was a distraction from his tax scandal. On the far right, conspiracy theorists there suggested that this was part of his grand plan to take down the Washington elite somehow. The details on that are a bit murky. We're not going to get into those details, but there were plenty of theories.
So given the online theories that are raging all over the place, and the fact that throughout history, administrations have been, shall we say, careful about disclosing all medical details about the president, can we believe the information that's coming out of the White House?
Well, yes and no. Take the statement yesterday from his personal physician. He did not answer the question about oxygen, on whether the president at any time had been on oxygen. He didn't answer those questions clearly. The White House has also not been forthcoming when it comes to the timeline. We know that Hope Hicks, the aide who first had symptoms, she had symptoms for 24 hours before the news broke. And when the news of her positive test broke, that did not come from the White House, that came from Bloomberg News. We also know that the president went to a fundraising event in New Jersey after he knew that Hope Hicks had tested positive. And as you said, in the past, this White House especially has not been very forthcoming when it comes to disclosing medical records. There was an incident a few years back of a letter written by Trump's former personal physician saying that he was at good health. Turned out that had been dictated by Trump himself. And there was also an unplanned hospital visit to this same hospital in November last year, to which we still have no explanation.
Why is it so important that we get accurate information?
The health of the US president is very important. It's the biggest, he's the leader of the biggest economy in the world. The markets were rattled this week when news of his COVID broke. If he is incapacitated, say if he is on oxygen, if he is on a respirator, that's a matter of national security, especially if you imagine how some decision-making processes happen in this White House. Sometimes the president will make decisions and the people below him might not even know about them. So you could see a breakdown of communication. It's also, of course, an issue for people's health. There was a survey this week saying that Donald Trump himself was the biggest source of misinformation about the coronavirus in the US. And a lot of people get most, if not all, of their news from social media. So we're dealing really here with differing realities, differing versions of the story. The physician yesterday said his condition was improving. Earlier, the chief of staff said that his condition was very concerning, and the president himself said we would see the severity of the illness in the next few days. So who do you believe?
Well, whoever you believe, I have a feeling that this discussion will continue long after Donald Trump gets out of the hospital. Ola Alsika, thank you so much for that.